Welcome to Project Firstline Rhode Island's live webinar, Preventing Sepsis Part 2, Core Elements of a Sepsis Program. Here we will learn the key components to an effective sepsis program and hopefully be able to apply some of what we learn to our healthcare facilities to help our sepsis prevention programs grow even stronger. Let's just start with some quick introductions. So my name is Allison Thurber. I am a nurse at the Rhode Island Department of Health in the Center for Acute Infectious Disease Epidemiology. And I am so happy to be with you here today as your training liaison. I'm also joined by some members of the Project Firstline staff behind the scenes, as well as our team medical consultant, Dr. Kearney. So I'll pause here and give Dr. Kearney a moment to introduce herself.
Hi, everyone. Welcome. Thanks so much for being here. Let us know if there's any questions throughout the webinar today.
Thanks, Dr. Kearney. So yes, getting into what she just said, a few housekeeping items. This webinar will last about an hour, and we have included ample time for a Q&A at the end. As the session moves along, we will not pause for questions. However, if you put your questions in the Q&A box, either at the top or bottom of your screen, depending on how you have your Zoom account set up, we will be able to answer your questions live at the end. There's also a chat box, which some of you may have already started utilizing. This is a feature that you can use to communicate with myself and the team as the webinar moves along, as well as with other webinar attendees. So since we introduced ourselves, I do invite you to all practice our chat feature now and introduce yourselves in the chat. Let us know where you're coming from. Sometimes the chat's a little temperamental, so it also gives us a moment to make sure the chat's working. Great, it looks like we have a lot of folks from skilled nursing facilities, veterans home. That's great. Kind of all over our state, which is wonderful. All right, so we will be offering continuing education criteria or continuing education credit. So the criteria for those of you who are attending and would like to receive CNA credit are as follows. To receive your certificate of training, your CE Dental IPC, or your CE EMS, you will need to complete your pre-session survey, which was put in our chat box and emailed to you, attend the entire webinar, and then complete the post-session survey. This session is also approved as one contact hour. This is a nursing continuing professional development activity approved by the Northeast Multi-State Division Education Unit as an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. So to receive your CNE credit, you will need to complete the pre-session survey, attend the entire webinar, the post-session survey, and then the post-session quiz. The post-session quiz is only required for your CNA and is optional for everybody else. We will go over these in the end, along with important dates that you need to know. So don't worry if you happen to miss any of it. All right. So today's agenda is starts with welcome and introductions, and we've just completed that. So we'll hop on over next to learning objectives. Then we'll talk about preventing sepsis 1, which was our webinar a few weeks ago, and we'll recap the important things that we learned on that webinar. Then we'll jump to the core elements to a sepsis program and program creation and continued resources. We'll have our key takeaways and then our Q&A as promised. So our learning objectives for today: to understand the purpose and importance of a sepsis program, to know the core elements to a sepsis program, and to know where to find key resources to assist in creating a sepsis program. Again, I want to put in the Get Ahead of Sepsis plug. We did talk about this in Sepsis 1 webinar. So CDC's Get Ahead of Sepsis educational effort helps educate consumers and healthcare providers about the importance of early recognition and timely treatment of sepsis, reassessment of antibiotic needs, and prevention of infection. The Get Ahead of Sepsis educational effort seeks to optimize healthcare quality and patient safety by raising awareness and knowledge and motivating behavior change related to prevention of infections that can lead to sepsis, and early recognition of and appropriate treatment for sepsis among consumer and healthcare provider target audiences. So CDC's Get Ahead of Sepsis campaign has a lot of great resources. And throughout this webinar, we will reference it a few times. We will also make sure we put it in your end of session resources or that you'll receive tomorrow. All right, so I'd like to start by watching a quick video made by CDC showing the impact sepsis can have on our patients and their families and highlighting the importance of a structured sepsis program.
He was displaying sepsis symptoms that we didn't know what that was. So that night, he had a fever that went to 104.5. Niall died the next morning, 2006, April 17th.
We were absolutely in shock when this happened. And he was, the love of our life, really. He was part of what we did day in and day out. So it's been a big loss for us.
He had been in the hospital. He'd been in there for care. He had a fever. He had flu-like symptoms. Niall died because they didn't know how to read the absolutely positive signs of sepsis.
We tried to keep his spirit alive. It really inspired us to do something about it, to stand up and try to make a difference for other people so that they wouldn't have to go through a similar type of event that we went through.
So as the video says, think sepsis, know the signs and symptoms of sepsis, and act fast. So unfortunately, lack of sepsis education ended in a tragedy for Miles and his family. But this video highlights in a very short amount of time just how important it is to know the signs and symptoms of sepsis, to respond quickly to those symptoms, and to have a strong sepsis program in place in your facility. So let's start by recapping some of the key take-homes from the Preventing Sepsis 1 webinar a few weeks ago that'll kind of lay the scene for our core elements. So sepsis is the body's extreme response to an infection, and it is a life-threatening medical emergency. Sepsis happens when an infection you already have triggers a chain reaction throughout your body. Without timely treatment, sepsis can lead to tissue damage, organ failure, and death. Bacterial infections cause most cases of sepsis. Sepsis can also be a result of other infections, including viral infections like COVID-19 or the flu, or fungal infections. Infections that lead to sepsis most often start in the gastrointestinal tract, lungs, skin, or urinary tract. And as we've said already multiple times throughout this webinar, and it hasn't even started barely, know the signs and symptoms of sepsis. So signs and symptoms of sepsis include a high heart rate or weak pulse, fever, shivering, or feeling very cold, confusion or disorientation, shortness of breath, extreme pain or discomfort, or clammy or sweaty skin. So there are key infection control and prevention practices to prevent sepsis, and those include performing hand hygiene and preventing healthcare-associated infections. So that includes appropriate indwelling medical device management, oral care and proper positioning, and appropriate skin and wound care. This also includes adhering to standard transmission-based and enhanced barriers precautions, recognizing and communicating the signs and symptoms of sepsis, and educating our patients and families about sepsis. At the end of the day, these were our key takeaways from our Sepsis 1 webinar, again, a few weeks ago. That includes sepsis being the body's extreme response to an infection. It is a life-threatening emergency. Bacterial infections cause most cases of sepsis and start in the GI tract, lungs, skin, and urinary tract. And recognizing signs and symptoms of sepsis rapidly can decrease the severity of infection and allow for better patient outcomes. So let's start talking about sepsis programs. There were 6 factors that were identified as critical for improving the delivery of recommended sepsis practices. And this includes healthcare staff knowing what to do and why, healthcare staff understanding the risks and benefits of treatment, healthcare staff having strong team collaboration, healthcare staff feeling empowered and supported, hospitals having adequate staffing, and lastly, patient and family education. So the core elements of hospital sepsis programs are intended to monitor and optimize hospital management and outcomes of sepsis. They complement existing sepsis guidelines and help facilitate implementation of guideline-recommended care practices that apply to a broad range of persons with sepsis, including adults, children, women, and those who are postpartum. It's important to know that there's no single template for a hospital sepsis program. Rather, the complexity of medical decision-making in identification and management of sepsis and the variability of sepsis epidemiology and patient populations served by hospitals and healthcare systems in the United States. And this requires flexibility in the structure of hospital sepsis programs and the implementation of sepsis care. Even though programs are not one size fits all, sepsis programs can be implemented effectively in a wide variety of hospitals and healthcare system settings. Regardless of the structure of a hospital or healthcare system, the core elements should help healthcare staff improve outcomes from sepsis by aiding in the recognition of sepsis, facilitating the implementation of evidence-based management of sepsis, supporting the recovery of patients after sepsis, and monitoring the impact of hospital-based interventions to improve the care and outcomes of sepsis. So there are some challenges. So despite the availability of evidence-based guidelines for sepsis, success of several large-scale quality improvement initiatives, and growing interest in clinical decision support, much hospital core elements work remains to ensure hospital optimal sepsis care in hospitals. Sepsis is complex. It's a complex condition, and it requires care to be coordinated across multiple clinical care locations and disciplines, and has to be tailored to specific infections and clinical presentations. So again, one size does not fit all. So you'll likely start with your needs assessment, and your needs assessments are what will help determine what type of program would best suit your facility. One other challenge of sepsis programs is the common misconception that antimicrobial stewardship hinders the management of sepsis. And that is not the case, and is quite the opposite. Antimicrobial stewardship programs can play a really important role in optimizing the use of antibiotics, ultimately leading to better patient outcomes. So it's important to make certain and know that it's possible for hospitals and healthcare facilities to make simultaneous improvements in sepsis management and antimicrobial stewardship. So getting started. If you currently do not have an established sepsis program at all in your facility, I wanted to start by addressing the most efficient way to get started. So first, it's recommended to identify the program leader or co-leaders. Next, secure support from hospital or healthcare system leadership. So you need strong leadership and influence to help drive the efforts and be able to put key elements into place on a larger scale. Next, you want to start with a needs assessment. So this will help you identify applicable regulatory or reporting requirements, existing sepsis screening processes, treatment guidelines, and order sets. Your needs assessment is going to be the driving force to establish what exactly your facility needs and to identify your facility's strengths and where there is room for improvement. And then lastly, to begin your sepsis program, you will need to establish goals based upon your needs assessment. All right, so let's jump into the core elements. The core elements of hospital sepsis programs are intended to monitor and optimize hospital management and the outcomes of sepsis. So here you can see the core elements of the hospital sepsis program. This includes hospital leadership commitment, accountability, multi-professional expertise, action, tracking, reporting, and education. So CDC has gone ahead and grouped a few of these core elements together, focusing on 5 core elements that we will discuss in further detail. CDC also has a 5-part video course that addresses each of these topics in more detail, and we will make sure that we send you that link in the post-session resources. So the 5 groupings are leadership commitment, accountability with multi-professional expertise, action, tracking with reporting, and education. All right, so first we have the core element, hospital leadership commitment. And hospital leadership commitment is important because it's what drives the program and allows for necessary human, financial, and information technology resources. Support from hospital and health system leadership, especially that of the chief medical officer and chief nursing officers, is critical to the success of the hospital sepsis programs. Barriers to successful programs include lack of engagement from hospital clinicians and staff and insufficient resources to effectively run your sepsis program. By setting sepsis performance improvement as a priority and allocating necessary resources to the program, hospital and healthcare leadership can help ensure that sepsis programs have the engagement and resources necessary to accomplish their goals in the end. So next we have accountability and multi-professional expertise. The core elements of accountability and multi-professional expertise address appointing a leader or co-leaders responsible for program goals and outcomes and engaging key partners throughout the hospital and healthcare system. Effective leadership, management, and communication skills, as well as clinical expertise in sepsis, are essential to a successful program. Sepsis programs require engagement of multidisciplinary partners throughout the hospital. So this includes clinicians and healthcare staff who support the care of patients with sepsis throughout the organization, individuals who facilitate performance evaluation and improvement activities, and this includes data analytics and information technology, and patients and family members and caregivers who can then provide insight into the experience of being hospitalized with and recovering from sepsis. So on the screen, you can see some examples of how to implement accountability and multidisciplinary expertise in the creation of a sepsis program. So you can see gathering different disciplines, possibly creating a steering committee, meeting with your MDs, nurses, pharmacists, etc., on a regular cadence. Maybe that's monthly, maybe that's bi-monthly. Creating a goal, a measurable goal. Reviewing challenges and successes, and then celebrating those successes and providing feedback to your staff and team on how we can improve upon things that we may need to improve upon. So then we have action. The core element of action is all about implementing structures and processes to improve the identification of, management of, and recovery from sepsis. So the main goal of a hospital sepsis program is to improve the treatment and outcomes of patients with sepsis. To support this goal, sepsis programs should develop and implement structures and processes to facilitate recognition of sepsis, evidence-based management of sepsis, and longer-term recovery from sepsis. When designing and implementing interventions to improve sepsis management, it's important to use structured quality improvement processes to promote the uptake of the intervention. Additionally, hospital sepsis programs should monitor use and effectiveness of hospital interventions and refine interventions as needed to optimize treatment and outcomes. So some common actions you can see on your screen here, you may have heard of before, like standardized screening processes, creating order sets for antimicrobials for sepsis patients, assuring common antibiotics are stocked in the Pyxis, ready to go if we need them, creating algorithms for IV fluids, antibiotics, blood cultures, things that prompt people of the next steps. Follow-up appointments are made on discharge, so making sure your patients know what's coming next. And in that same idea, possibly a template of discharge instructions, so when to seek medical attention, early warning signs of sepsis, and comprehensive instructions for what your patients need to do once they're discharged. Other examples can include perhaps a sepsis team. So some hospitals have like a code sepsis that they call, and a team responds to that patient. Perhaps asking allergies and making sure that they're true allergies to antibiotics, and some post-discharge continuity of care. So we have tracking and reporting. So the core elements of tracking and reporting focus on sepsis epidemiology, management, and outcomes to assess the impact of the initiatives in your program. Then providing that information on that sepsis management and outcomes to relevant partners, including your floor staff. Tracking of sepsis epidemiology, management, and outcomes is critical for identifying gaps, trends, and improvement opportunities, as well as for understanding the impact of your care sepsis intervention and programs towards hospital sepsis goals. So before tracking sepsis metrics, it's important to prioritize what to measure, focusing on processes and outcomes that are most important to patients and anticipated to represent the greatest opportunity for improvement in the program. Coordinating with infection control can frequently be a really great way to start, as infection control can pull pertinent data to help measure effectiveness. Reporting of sepsis treatment and outcomes to relevant staff can help maintain staff engagement, motivate behavior change, and facilitate improvement in sepsis treatment and outcomes. It's critical that information be provided in a clear and transparent manner. Unit-specific data is usually an effective way of reporting. Reports to hospital leadership and the board can also help raise awareness of and support for sepsis program efforts. So a quick side note, not too long ago, I was visiting a family member in the hospital, and they had a bulletin board on their floor. And that bulletin board had all of this information that we're talking about. So it had the information of, the last time they had a case of sepsis on their floor, some of the things that they do to help prevent or manage sepsis on their floor, and a few shout outs to some special people on the floor who have helped contribute to this. And it was nice seeing it as somebody who had a loved one on the unit to know that they're taking this into consideration. And, it made me think, okay, they're not going to mess up this with my loved one. All right. So the core element of education is our last one, and this refers to providing sepsis education to healthcare professionals, patients, and family and caregivers. So for optimal sepsis treatment and outcomes, it's imperative that hospital staff have a strong knowledge of sepsis and understand their role in team-based management of sepsis. Educational efforts should be focused on all healthcare workers involved in sepsis care, all patient-facing staff, and all health profession trainees. There are many methods of providing education to hospital staff, including simulation or case-based training, in-person or video-recorded lectures, flyers or posters, emails or newsletters. The approach really may vary depending on your facility and the audience. Knowledge of sepsis is also really important to patients, families, and caregivers. So staff should be educating patients and families throughout their stay, as well as prior to discharge, so that the patient can have tools to take with them home to help prevent sepsis themselves. So the fact sheet or poster here that you see in front of you on the screen is to help staff understand where germs live and how they spread in healthcare. And this can help them recognize risks and take the right infection control actions. You can use this fact sheet to share information about how infection control also helps fight antimicrobial resistance. So also on this page, and it will be included in the post-session resources, I have listed CDC's Get Ahead of Sepsis campaign materials that include education for patients. It does have very specific material for patients, like for a postpartum mom, for a parent taking care of a child. So it's really nice because you can kind of customize to your patient and not give them just a generic sepsis material. So then we have the sepsis program assessment tool. So this is to help assess your current program. And CDC created this assessment tool as a companion to the hospital sepsis program core elements. This tool provides examples of ways to implement the core elements. They're intended to be an adaptable framework that hospitals can use to guide efforts to optimize sepsis care. And not all examples in the core elements may be necessary and or feasible in all hospitals and healthcare systems. The assessment tool can be used on a periodic basis, for example, annually, to assess current program and then create actions to improve the effectiveness of that sepsis program. So above, you can see one section of the assessment tool. And this is the part that focuses on hospital leadership commitment. It's just a quick, easy checkbox, yes or no. And then next to that, you can write in any comments that you see or feel as though you need, so you can go back to that and address that afterwards. So our team has compiled a list of resources for you to help with any sepsis program assistance that you may need. The hospital sepsis program core elements is one of the initiatives that's what we've been talking about this afternoon. And this helps to improve awareness, management, and outcomes of sepsis. CDC also has published a toolkit to support surveillance of sepsis, hospitalizations, hospital toolkit for adult sepsis surveillance. So that's before you on the screen. Again, we will get these all into our post-session resources for you. CDC also, as we have mentioned, has their national education effort, Get Ahead of Sepsis, GAOS campaign, that emphasizes the importance of early recognition, timely treatment, reassessment of antibiotic needs, and prevention of infection. And the campaign has a suite of free sepsis patient and healthcare professional education materials. And then we have the Severe Sepsis and Septic Shock Management Bundle. CMS Center for Medicare Medicaid provides a document for bundling septic care. The implementation of this bundle has been associated with improved clinical outcomes, including reduced mortality rates. Studies have shown that adherence to the bundle elements leads to better patient care and outcomes compared to when these interventions are not performed consistently. And lastly, we have the CDC sepsis assessment tool that is specific to nursing homes. All of these links, again, will be added to the post-session resources for you to have following this webinar. So key takeaways for today. Sepsis is a leading cause of hospitalization and hospital mortality, contributing to over a third of all hospital deaths. There is no one-fits-all sepsis program for all facilities. Sepsis programs are based upon a facility-specific needs assessment and associated goals. It is possible for hospitals to make simultaneous improvements in sepsis management and antimicrobial stewardship. And effective leadership is required to engage with multidisciplinary expertise required to support the care of patients with sepsis. All right, so as promised, we're going to go through our certificate of training again. So I'd like to remind everyone that there are a few requirements if you wish to receive your certificate of training. So in order to receive your certificate of training, you must complete our pre-session survey, participate in today's Zoom session, and complete the post-session survey. A link for the post-session survey will be sent to you via email tomorrow, June 16th, and will be available until June 22nd at midnight. Once you complete the requirements, a certificate of training will be emailed in PDF form on June 25th. For EMS and dental providers, this can be used towards 1 hour of continuing education credit, and you would have the same criteria as I just stated. Please be sure, if you are looking to receive CNE credit, that you complete the pre-session survey, the post-session survey, attend the webinar, and then the post-session quiz that will be mailed to you tomorrow. For everyone else who is specifically not receiving CNE credits, the post-session quiz would be optional. This afternoon, the post-session training resources and this PowerPoint will be emailed to all who attended today's session. So if you do not enter your email earlier in the chat, please feel free to enter it now to be added to our distribution list. You can also email Project Firstline directly if you ever have any questions. And you can click on our live events link through our website. Please go ahead and follow Project Firstline on social media if you haven't already done so yet. You can see on the side here of the screen, we have our tag names for each platform. We have YouTube, X, Facebook, Instagram, and LinkedIn. All right, so here are the references for today's session, not to be confused with the post-session resources. We'll send those to you with all of the great links that we have for you to refer to if you have any questions about your sepsis programs. And we are going to take a moment, if you have some time, to complete our end of session feedback poll. It's just a quick 3-question poll. And it just helps us improve future trainings to suit your learning needs and tell us how we did. All right. So on behalf of Project Firstline Rhode Island, this is our last live webinar today, and I want to say thank you for supporting and joining us over the past 6 years. It's been such a pleasure to learn alongside you and navigate the special circumstances we deal with in preventing and controlling infection in the healthcare setting. As some of you may already know, Project Firstline will be shifting away from hosting live webinars, but we will still have our website up with recordings of all our previous webinar material and resources so that they'll all still be available to you should you need them. In addition, if you find yourselves in need of any infection prevention and control guidance, please do not hesitate to reach out to the Rhode Island Department of Health Center for Acute Infectious Disease Epidemiology. That's where I will maintain my position, and I'd be happy to answer any questions that you have, along with my colleagues and nurses that I work with on a day-to-day. So please reach out to us if you have any questions. And at this time, I will invite Dr. Kearney to join us back on screen, and we can take a look and see if there's any questions for the Q&A.
I'm not seeing anything right now, Allie.
Okay, perfect. I didn't have a chance to fully look through them all, so thank you. I don't see anything in the chat box as well. So if anybody has any questions, feel free to email us. Our email will keep going. So we will be able to get back to you if you have anything. Otherwise, thank you so much. I hope you enjoyed this webinar. We've really enjoyed being with you these past 6 years, and have a good afternoon.